Good afternoon, everybody, in this beautiful afternoon here in Wenham. And today is our second forum. Actually, I guess it could be considered our third forum, right? Because we did two. But we are for COVID-19 Public Health Forum. This afternoon's will be recorded and for playback later on HW Cam. So I want to start by introducing our panelists for today. First is Mary Beth Ting, who is our public health nurse. Then we have Captain Kevin DiNapoli from the Wenham Police Department. Our fire chief, I see him, there he is, Chief Kavanaugh. Our Board of Health Chairman extraordinaire, Dr. Andrew Ting. And we're going to get started. I think I'm going to go to Mary Beth first, that can maybe provide, I'm going to go to each panelist and ask for a little summary of what's going on in your world, and then we'll open it up to questions. So we'll start with Mary Beth to give us an update on COVID-19 here in Wenham. Mary Beth?
Thank you, Anthony. So good afternoon, everyone who's tuned in. Thank you so much for your attention and for coming. It's nice to see the names and photos of individuals who are here. Just to recap, for those of you who have not tuned in to any updates before, the role that I have as your public health nurse in town is I keep track of individuals who have been identified as testing positive for COVID-19 in the town. That comes to me through the Department of Public Health through laboratory testing results are filtered in through an electronic system that we use called Maven. And so once I get notified that there is a positive test, I call residents, I talk to them. I want to be sure that they're feeling well to see if there's any resources that they need in terms of food or medication or anything to help them during their period of isolation. And we use the word isolation for those who are infected with the virus. While we're talking on the phone, I also ask about anyone that they've been in contact with during the period just prior to their becoming ill or testing positive that needs to be in quarantine. And quarantine, although we're all using the term about being in quarantine, in public health circles, that's the term that is for those who are confined to their home because they've been exposed to someone infected with the virus. And so we identify who those people are, and then I follow up with those individuals to give them guidance about their need for quarantine. Sometimes that's within our own town. Sometimes I'm passing that information off to public health colleagues in other towns, cities and towns. So that's a big part of my job. If you have questions or concerns, you can call or email me about that. Another role that I play during this COVID-19 crisis is I meet regularly, usually it's 3 times a week, as part of a public health and public safety team. And we meet together virtually via Zoom to talk about ways that we can be responding, things that need to be adjusted, being sure that all team members are informed. I will let you know that there is a mechanism now. The governor had made clear that our public safety employees are notified by me when I know that there's an individual who is positive for COVID-19. I let police and fire know so that if they're responding to that address only, not the individual's name, but that address only, that they know that they need to be using full personal protective equipment. It's essential considering the small town that we have and the small but mighty dedicated public safety officials we have, that we keep them safe so that we as a town can respond as needed to emergency situations. So that's something I do. I'm also very busy staying abreast of changing information from the Department of Public Health. I'm on calls at least 4 times a week with the Department of Public Health for updates about how we're managing things, how guidance is changing. So most recently that was guidance around open spaces. There was recent guidance around something that I should share also is guidance was changed last week about individuals who are contacts of those who have tested positive are now recommended to go and seek the nasopharyngeal swab for testing for COVID-19 so that we can try to really get on top of the spread of this virus. So that sort of encapsulates my responsibilities right now during COVID-19, and I am happy to be of assistance to all the residents of our town.
Thank you, Mary Beth. I'm going to go to Dr. Ting. How are you, Dr. Ting?
Good. Thank you for everyone for joining us in this public forum. We appreciate the citizens of the town of Wenham in really doing a great job following the guidance that have come from both the Centers for Disease Control, the CDC, and the Massachusetts Department of Public Health, the Mass DPH. I know that we have been working hard in trying to keep everyone safe by putting in place certain orders and regulations, whether they be face coverings and visiting any kind of businesses inside, or what we had before, which was closing all the public parks and trails and such. And so some good news, at least that comes through this, is that the governor on May 18th came out with some new guidance for reopening Massachusetts. It is a slow and well thought out plan that has 4 phases. And one of the first parts of the phases is actually something that we've gotten a lot of emails and phone calls about, is the use of open space. And so if you have not yet seen on Facebook or on the town webpage, we did vote yesterday to reopen some of the open spaces with some caveats. So please take a look at those, but I can go further into it if you'd like me to. But starting on May the 25th, which is Memorial Day, you'll get to start to enjoy some of the open spaces that were previously held off in order to keep control over COVID-19 spread. As your chair of the department, or the chair of the Board of Health, it's my job to make sure that we weigh both the concern of the spread of COVID-19 within our community versus the citizens being able to enjoy sort of the open space, as well as other components that are in town. So we will continue. Again, Mary Beth had mentioned guidance changes every single day. We hear something new. So we are trying to keep on top of it. And as we know about it, we will filter through that information, and then we will communicate it to you via Facebook or our town webpage. We have a special COVID webpage. When you get to the town webpage, please take a look at that. That has a lot of resources, anywhere from knowing more about COVID-19 and statistics, as well as, which has been significant, is sort of behavioral mental health resources during this time. So I'm happy to answer any questions about the board's input in this whole scenario.
Thank you, Dr. Ting. Chief Kavanaugh, what's going on in the world of fire with regards to COVID-19?
Well, besides we're just getting a run right now, but welcome everyone. Thank you for joining us today. As most people are aware, the doors to the station are still locked, but there is a phone on the outside, which is a direct line to North Shore Regional Communication Center. Just in case of an emergency, you can pick that up, and it goes right to them. The department is doing final construction inspections and sale and transfer inspections under a new process. And that process is, you as the homeowner or construction supervisor must have that building sanitized by a professional company before we will inspect. And once that is done and confirmed, we will come in and inspect the property, and it seems to be working out great so far. And for keeping this building safe while running the ambulance, we're on the front lines every day with it. So we continually wipe down our station twice a day. The ambulance gets wiped down twice a day. And if there is a COVID-related call with the ambulance, it takes almost an hour to clean that ambulance after the call, which is a lengthy process. And we also have the station fogged twice a week at a minimum. And other than that, that's about it.
All right. Thank you, Chief Kavanaugh. Captain DiNapoli?
Good afternoon, everybody. Glad to be part of the event here this afternoon. Early on, I think the best thing we did, we mentioned it in prior meetings, was when Town Administrator Ansaldi convened this group to get it together, and it's been a phenomenal working group. So happy to be proud of working with the fire and public health and the town hall personnel to kind of keep us all together. And it's been pretty much a daily process between the Zooms and the interaction with each other to stay ahead of the curve with the, as obviously, as we all know, with the ever evolving change of everything that's been going on. So real proud of that. I'm proud of the police employees that have been reliable and consistent throughout the whole thing, coming to work and being available and having a great attitude with the different procedures and day-to-day operations that have changed. Specific to what our duties have been, we've been focusing on, enhanced saturated patrols in the areas that are of concern as things were tightened up originally, and now that they're changing, mentioned by Dr. Ting, we've been focusing on those areas. And as mentioned in prior meetings as well, I want to thank the public for being so accommodating and so respectful to what our duties are, whether it's the police or fire or town officials, understanding that we have a job to do. And there have been some circumstances, luckily very limited, very isolated, where we've spoken with folks and kind of steered them in the right direction. And it's been nothing but professional from both sides, and things have been great with folks being told, what to keep themselves safe and others safe, and just getting things where they need to be. As far as, luckily, thank God, all police personnel have stayed healthy, knock on wood. We've changed our procedures relative when it first started as well to having everyone check in. We're doing regular check-ins with every employee to try to cut things off at the pass ahead of time before they do come to the station. And we've been consistent with that all along. And thank God everyone has been healthy with that as well. And that's it. It's just, business as usual. We're still available all day. We're working 24 hours a day, and the officers are out there and available at any time for any reason. And just thank you again for everyone for your cooperation.
Thank you, Captain. And for those of you who are joining us live, if you have questions, and really questions help stimulate a conversation other than what some of the ones that we've already had submitted to us, I'd love to hear from you. The panel would love to hear from you. Just go in the chat function, type in your question, and we'll read your question and get it answered from our panelists. So I'm going to start with masks and face coverings. We've had some emails from community members that are concerned that they walk outside and somebody's not wearing a mask. So I think there might be some confusion about when you have to wear a face covering and when you don't have to wear a face covering. So who wants to take this? Maybe Beth's kind of smiled, or Dr. Ting, or either one. Yeah,
Pointing to her.
I saw that. That worked out well, Dr. Ting.
I'll be happy to start. And I think for enforcement, I might push enforcement to either Dr. Ting or Captain DiNapoli. So the language, I would confess, I think the language has been kind of confusing in terms of the history. I will say that Wenham, and I know also Hamilton, had passed ordinances from the Board of Health requiring them indoors prior to the governor making that mandatory. So the language, the way it is now, and Jackie Bresnahan from Town Hall has the language up. If we wanted to, we can pull that up, but I would refer you to mass.gov where you can actually see the language of the order from the governor. But the way it reads now is that all individuals must have them on in an indoor facility, regardless of what that indoor facility is. They're required indoors. Outdoors, they are required when there is a reasonable expectation that 6 feet of physical distancing cannot be maintained. I think the the state is still using social distancing. We have been moving to using physical distancing, which is recommended by the World Health Organization. So if there's a reasonable expectation that 6 feet of distance between yourself and someone not of your household can be maintained, that is when you are required to have a face covering. So my take on it as your public health nurse, there we go. There's the way that the order reads. So my recommendation as your public health nurse is to take a page from the Book of the Boy Scouts and be prepared. I was speaking with Jackie Bresnahan from Town Hall earlier today. She has the type of mask that has straps that tie in 2 places. And so for that kind of mask, if you're someone that has a mask like that, you can have it hanging down. And when you're approaching someone, you can pull it right on up. You don't really want to be touching the front of it because that's going to contaminate your hands. Generally, you want to be removing it from the ear straps. But it all depends what you're using for a face mask. A bandana you can pull up. I know that our town administrator went for a run and had a face covering that he could pull up when he was approaching another individual. I want to be very forthright with you. The weather is getting hotter. This is going to be more of a challenge for all of us. But it is important for us to be able to enjoy, we've come sort of over the hump right now with new cases and with incidents of death. And we want to stay that way. The big concern that I and many others have in the public health community is that with more opening up, we're going to have more cases and more difficulty and a potential spike. So in order to avoid shutting things back up again, we all need to be very good about our personal protective measures. And face coverings is a big part of that. So please do keep in mind, there are individuals in our community, I would say many of the people I've spoken with who are expressing complaints are at higher risk for COVID. They are elderly, they have underlying health conditions. And so when they see people out exercising, walking, biking, whatever, without a face covering, they feel personally at risk by that. So please do try to protect others. And again, the rationale for the face covering is that we have found during our learning about this, that individuals can be infectious before they have any symptoms. So your face covering is your gift to your fellow community members. You are protecting them from any droplet spread from you in the case that you might be infectious and not yet know it.
Follow up to that, Mary Beth. What about food establishments? There's a question from one of our audience members. Should those workers be wearing face coverings?
My understanding from all the guidance I've read is that yes, they're required to be wearing face coverings. Dr. Ting has a comment.
Yes, Dr. Ting.
So on April the 15th, the Board of Health did pass an order regarding face coverings for essential businesses as defined by Governor Baker, which would include food establishments. So any interaction between someone in a business and the public, a face covering must be used. And then anytime workers within a business are within 6 feet, they should be wearing a face covering as well. So if you're in an office by yourself, like I am, I'm not wearing a face covering because there's no one else in here except for me. That would be suitable. But at any time when I leave my room, I put my mask on because I'm going to be interacting with someone in my office. But yes, so both the patron would need to wear a face mask entering. Hopefully there's signage up on those businesses that's requiring you to put a face mask on, as well as all employees must wear one as they interact with the public, or if they're going to be interacting with themselves and cannot distance more than 6 feet.
I would just add, I know from the calls that I've been on with DPH, there's been some discussion around those who are working like over a hot grill or other things. So there are some different guidance about those specific personnel, but like prep line personnel, if they're going to be in close proximity, are to be wearing face coverings. So if the questioner is someone who works in food service and needs more specific guidance, please do feel free to call us and I will look up those particular details.
Thank you. Captain DiNapoli, I know last weekend one of the nice days. We had extra an officer working over at the rail trail. How did what was that like? How was his response from residents and engaging with them? And were they wearing face coverings? Did he say?
It was great. Yeah, he said, it was more of an education-based interaction, which was nice. He had a table set up with some education materials that was forwarded to me through Mary Beth through the Department of Public Health, and he had some water set up, kind of a little station, if you will, and he said there were quite a bit of people. Obviously, as you mentioned, Anthony, as the weather's getting nicer, we're going to see that more and more. But it was good. The biggest thing that we've been trying to do through all of this is education and guiding people in the right direction. Obviously, all along, a straight out, enforcement is a last case scenario for anyone. We provided several verbal warnings, most of which were for people in certain areas as opposed to not practicing certain behaviors. It was more of people where they shouldn't be and just moving them along. But, this past weekend, and we anticipate this weekend coming up, same thing. We do have added patrol, added officers as well, and they're going to hit those high traffic areas too.
And speaking of this weekend, normally we all would enjoy some kind of a barbecue and get together with family and friends. What's permitted this weekend and what's not? Which panelist?
So the governor has not changed the gathering number. So we are still restricted to gatherings of under 10 people. So for the Ting family, we're 6. We can get together with 4 other people. It's a loss for all of us, who have enjoyed getting together with extended family, friends. So the recommendation, this goes to, the mental health piece, is to please do try to use the technological gatherings that we have access to. Schedule a Zoom conference with family and friends so that you can get together remotely to see them. But we are not to gather with more than 10. And if, for example, if you're going to be gathering with neighbors, you should stay at 6 feet of distance between households. You don't really want to have the mixing of households right now, because that's just increasing the possibility of mixing of germ pools, as it were.
Chief Kavanaugh, anything as far as opening of fires or anything that should be concerned as well and adding to that over Memorial Day weekend?
There's been no restriction put on them yet, and that usually comes down from the state. And other than that, just keep them small. And again, gathering under 10.
Thank you. Anybody else on that topic?
I would like to make a plug for the virtual Memorial Day celebration. We've got some really wonderful programming that is in the process of being completed or has been completed. I don't have the fullest update on that, but it's another way that we are having to adjust our Memorial Day celebration.
Yes, a lot of adjustments throughout this period, which was really for all of us. It's taken a toll, even mentally as well, and just being quarantined like this, something that we're not used to. And I know that in some communities we've seen spikes in domestic issues that the police have needed to respond to. Any services that you're aware of that are available for those that may be having a difficult time during this period, adjusting to life in quarantine? Dr. Ting?
Yeah, so as I mentioned, if you go to our webpage and go to the COVID-19 webpage, there's actually a link that says maintaining emotional health and well-being well-being during COVID-19 outbreak. And that takes you over to the CDC or actually the mass.gov website. And they actually have a lot of resources of, especially for both adults and children, of things that can help during this time in terms of reducing stress, helping you with activities that you can do that are safe, as well as then there are other things in terms of mental health crisis support, which is on the bottom there that Jackie is showing, and other phone numbers. So behavioral health and mental health providers know this is a very anxiety-provoking, stressful time, increasing anxiety. We've seen increase in depression. A lot of my mental health colleagues have been doing a lot of virtual visits with folks. So if you think, you're not sure what's going on, please give them a call. There's never a wrong time to call them and at least have a discussion with someone on a mental health level. And they could also provide you local resources if they felt like it was to the point where some intervention would be required. So hopefully with some, getting outside, even locally in your yard, doing some activities, getting some exercise in will be helpful. But yeah, so those are good resources on that page.
Thank you, Dr. Ting. And Captain DiNapoli, have we seen any type of spike in domestic violence issues?
Yeah, a little bit. Nothing over the top. Pretty much what we would have expected to see. It's tough. I mean, and our officers luckily are trained to talk to folks about that at the academy and through in-service training. They do have enhanced training on dealing with the mental health side of things. We have seen definitely a difference. And, depending on if it goes up or down, I mean, certainly, as the restrictions loosen, it opens up its other side of problems. But, if things tighten up again, we would probably see the uptick again. So luckily, our officers are trained to address that.
Thank you. Thank you, Captain. So, Dr. Ting, you mentioned Monday some of the restrictions that are opening with regards to parks. You mentioned the Braille Trail, and what exactly is playing Frisbee, and is that okay? And what other restrictions or what restrictions are there, and what can we do down at Pingree Park, and what can't we do down at Pingree Park or West Wenham Playground or anything else?
So yesterday the Board of Health met, and again with guidance from the governor's May 18th guidance for phase 1, which included reopening of parks or actually open spaces. We came away with what you see written here is that originally we had closed all the trails, athletic fields, parks, and playgrounds, and especially playground equipment. So we moved to reopen those as of May 25th, which is in line with the governor's timeline as well, with some caveats of that until we work out some more of the procedures and protocols for things like trash barrels and public restroom facilities. Those are not going to be open yet. So things as you can see that if you're going to bring trash in, you got to carry it out, especially at Pingree Park. Please, as Mary Beth had said, be prepared. Bring your own hand sanitizer. Bring a face covering with you. We are actually going to go a little bit increase in terms of how far apart we want people who are going to be out on some of the park areas or the open grass to about 12 feet, which is in line with what the procedure is for beaches. Just to make sure that there's no 6 feet is always trying hard to figure out, but if you go 12 feet, then we're going to be sure you guys are going to be safe. So the question about the Frisbee. So, we don't want to use shared sports equipment. So if a Frisbee, so I think somebody had a question is, if I play Frisbee with my family, that's okay, but why if I'm playing Frisbee with my friend, that is not okay? partly just because with your family, you have been with them probably for the last 10 weeks, like the rest of us inside. So you already have been exposed to each other. And if you have all been safe and healthy, that's great. And we want to keep it that way. But we don't know when you start to mix other members who are not part of your immediate household, whether it be family members or others in the immediate household. We don't really want those to be interacting with each other. So that's why we don't want you playing Frisbee with your friend, but with your family, that's fine. Or you could do one-time Frisbees and just buy a lot of them and just throw them, and then you're done with that one. So as you can see here, we're trying to keep the basketball and tennis courts closed. We feel at this point, once we open those up, they're going to be gathering places, and that would do two things. One, you'll probably exceed the 10 limit as that we currently have, as well as people will be coming into closer contact and probably sharing sports equipment. So for now, we're keeping those closed. The playground and playground equipment are going to continue to maintain to be closed because we don't have a good way of keeping them sanitized. As well as one of the public places that we're going to keep closed because right now the difficulty in the spacing is Pleasant Pond in that beachhead area. It's kind of a small spot and it's 12 feet apart. It doesn't leave much room. So we're going to be working with the town and trying to figure out a good plan for how to do that without also causing some difficulty with parking and safety that would occur with that. The rail trail back open, although people have been using it, we want you to use it. But again, we're going to keep the parking to the parking spot that is there off the road. The concern has been with the number of people visiting the 97 entrance to the rail trail is public safety. And Captain DiNapoli will tell you that having cars parked up and down 97, people getting out, opening doors, small children with their bikes, it just becomes unsafe, especially coming down that hill where speeds, you get picked up. So, and as always, if you can stay in your home area, that's the preferred. It's now what we call, I think Meredith have to, it's safer at home is now the sort of the new term instead of stay at home is safer at home. But again, if you can spend more time in your own home in that immediate area, the better. But yes, so these are the sort of the reopening with some of the restrictions associated with it. And then as time goes forward, as we see what happens, we'll make some further changes. Hopefully not backwards. That is the goal. That these things are open now because of the improvement we've seen, because we have been doing these measures, and we hope it continues so that we can open up more. But if obviously there's a resurgence that may get changed with the governor.
If I might, Dr. Ting, we have, in addition to the rail trail, there are a series of trails that are available for use in Wenham, and we would encourage people. The guidance has been all along that if you go to try to use a place and you see that it's very busy, to try to go at a different time when it's not as busy. So we're hoping that with all of the trails open, that people can find a trail that's not too congested to use, so that facilitates a little bit more the physical distancing one from another.
Thank you. And again, for those that are joining us, we appreciate the questions. If you have them, just throw them in the chat. At some point, I may run out of questions that were submitted. So anything that you want to ask. There's one thing so the folks know at home, and the panelists mentioned, since the outbreak happened back in March, we have been meeting 3 times a week as a public health, we call it our public health, public safety team, and monitoring their situation and the effects on Wenham and the state and Essex County and our neighboring communities and sharing information. One thing that folks at home need to be aware of is sometimes we just do not get any information in advance of what you're getting at the same time by viewing Governor Baker's news conference. So even with this last group of orders, it's surprising to us to some degree, and we have to react on it. So sometimes it takes us a little bit of time to do that, and but we quickly. That's why we meet so frequently, so we can stay on top of it. So some of these things we don't have an opportunity to really prepare and be ready for what he's going to come out with. But we're reacting, which is basically what we've been doing throughout this pandemic, is really reacting to what's thrown our way. And right from the beginning, this was a brand new virus that folks weren't aware of. And a lot of the answers in the beginning were, we just didn't know. And you heard face coverings, don't wear them, and leave them for our public health folks. And, so we mentioned it before, it's a fluid situation. It's always evolving, and it will continue to be like that too. So we expect, maybe the governor talked about every few weeks or so, or if the trends continue to hit the next phase, but it's a wait and see. So we all got to remain patient and vigilant during this time of uncertainty, which none of us do like. Getting back to one subject that came up at the last forum was around animals and dogs. And maybe we know a little bit more now than then, as far as, can dogs be carriers? Can we get sick from dogs, and could we pass that virus on to our dogs? So I think there's been some new information or something more that we know about that. Mary Beth, do you want to speak on that?
So it hasn't changed markedly since we last talked. Last time we were talking, it was mostly about the big cats at the Bronx Zoo. I did hear a small item on the news about the first owner and companion dog who were simultaneously infected. The guidance has, or my understanding of the guidance is that humans can transmit to their companion animals. And the guidance is also that for all of us with companion animals at home, that we treat them like members of our household, which most of us do. But specifically around COVID, what that means is that your dogs should not be interacting with other dogs or other people outside of your household. Just like we talked about not mixing households of people, you don't have your dog interacting with other dogs or other people. You just treat them like any of the other household members.
Thank you. Anything else further on that, Dr. Ting? You muted.
Yeah, so the CDC has a pretty good page on animal life and COVID-19 or SARS-CoV-2. Again, the data is not robust enough as to know exactly, but again, the risk is pretty low for both transmission from you if you have COVID-19 to give it to your pet or at least your animal, and then vice versa. So, again, if you have specific questions again about your animal, I would talk to your veterinarian about it. But as far as we know, there's very little risk to spread it back and forth. Again, Mary Beth says if you do have have COVID-19, you want to quarantine or isolate yourself as you would any other household member. So you do want to keep your animal apart from you as much as possible. But as far as we know, that is the extent. It's good that we don't hear about some other big animals or big cats with the infection, but I think right now, for the most part, unless you have COVID-19, that the risk of back and forth transmission is very small.
And Chief Kavanaugh, who doubles as our animal control officer too. Chief, have you had to check any of those big tigers that Jackie just showed us on the screen?
I have not.
I'm pretty sure those are not allowed as pets, right, Chief?
No, we haven't had any cases yet. And like Dr. Ting said, the CDC has most all the information. And it actually is a good read if you have the time.
And Chief, has all of our call firefighters and full-time staff remained healthy during this?
Yep, absolutely. We are very vigilant in that.
And what happens if you transport a COVID patient? What happens when you get back and that ambulance is, contaminated and staff was exposed to some degree with PPE on? What happens then?
We always have 3 people on board, 2 in the back with the whole getup, with the gown, the mask, the gloves, the face shield, the whole 9 yards. The driver is up front, sealed off. The 2 that come back, we have everything all set for them. They each take turns. They go upstairs. They will take a shower. Everyone has brought a change of clothes here. They will go up, bag everything they have, take a shower, and they are released after the call. And we continue to clean the ambulance again with the full mask, everything. And it takes about an hour, but we've done it so much right now, it's just second nature. It flows pretty well right now.
Great.
Everyone knows what to do.
Good.
Anthony, if I might, I see a question from Stephanie Graber. Thank you, Stephanie, for tuning in. Stephanie's question is, will the Wenham Canal be opened with the rail trail, and how about the iron rail soccer fields? So I will remind all residents, I don't think I initially knew this when I first moved here, that the canal is actually owned by the Beverly-Salem Water Board. So when the Wenham Board of Health made the decision to close parks, playgrounds, trails, and fields, they deferred to our judgment and similarly closed. I've checked with Jackie Bresnahan from Town Hall. She has reached out to them, informing them of our plan to reopen in line with the governor's recommendation on Memorial Day. We have not heard yet what their plan is. As soon as we do hear about both the canal as well as the Audubon properties, we will certainly make that announcement available to residents. I would anticipate that would probably come through the town website. If you have questions going forward, if you haven't heard from us and you're wanting to go down there for a walk, certainly give a call over to Town Hall and we can confirm that with you. Oh, Jackie's telling me that questions about their property should be directing to them. The face covering still applies.
Okay. And I see another question. With the new guidelines set up by the governor, will any business establishments now be allowed to be open for spa salons, spas, stores? And does the Board of Health have any role in this?
That's definitely in the phased reopen. Jackie, is it possible you could pull up the phased reopening page for us so we could look at that? I know that in phase 1, the things that were included on the 18th were construction, manufacturing, and houses of worship. And then the 25th included, Jackie, I think you have to scroll down to see the graphic. It might be on a different page. On the 25th includes pet grooming, car washes, external car washes, hair salons and barbershops, as well as office spaces, office spaces and laboratories, but they are allowed 25% of their capacity.
Occupancy, yes.
Sorry, yeah, occupancy, I beg your pardon. So I can't remember. Oh, there we go. That's the image I was thinking about. So Jackie, if you scroll down, and everybody, as you can see on the screen, it's coming from the mass.gov webpage, and it's the reopening 4-phase approach. Pretty easy to find, I would say, when you go to the mass.gov page. So if you keep going down, Jackie, it does go through the different timeline. So as you can see there, it's the 18th and then the 25th. Interestingly, just for everybody to know, I did hear from the DPH that hair services only are to be supplied in this phase 1 start. So if you were hoping to go get your facial or your brows waxed or other things, they're really only supposed to be caring for your hair at this point in time. I think there was a further part of that question, which was what role does the Board of Health have to play? The businesses are supposed to self-certify with the state. So the state has provided guidelines, templates, and protocols that businesses are supposed to prepare. And I can't remember when that's supposed to be provided. I know July 1st is one date. I would have to look that up because I don't want to give you the wrong information. But do you know, Anthony, off the top of your
No,
head?
I was going to say, but the information is available on somewhere on that, on the Mass.
Yep.
.gov COVID website.
And so what self-certification means is the business is saying, we are prepared, we have plans in place, and we will do everything to comply to make our workers and our customers safe. And so the onus, according to the state, is on customers and workers. If they feel that they are not safe, then they make a complaint to the local Board of Health. And the local Board of Health will take it up along with the Division of Labor Standards of the state for assistance with ameliorating whatever the complaint is. But as customers to these businesses, we're allowed to ask, you know, what's your plan? And they should have a plan available for you to see so that you can feel safe accessing the business. The other thing on May 25th is, I believe there's some additional curbside pickup for businesses. I don't see it right there.
Curbside.
Retail fulfillment. So you can either order something online from a retail establishment or order it on the telephone, and your pickup of your goods is designed to be no touch. So you pull up to the curb, you know, they might drop it back away, or maybe they put it into your trunk, but there should be no interaction between you and the fulfiller of the order. Very similar to what I think restaurants have been doing for curbside pickup right now.
Right. All right, there was another great question. That's what safety protocols due to COVID-19 will be in place for the election and town meeting. So one of the things that we're trying to do is we have a questionnaire that is available on our website. Jack, if you can pull that up so folks can go to the wenhamma.gov website. Jackie? There we go. All right, so right there. And what we want to do is we're trying to gauge if somebody is going to planning to vote or not vote, and if they're planning not to vote, why? Is it because of the pandemic, or is it just because they just don't vote? Which hopefully that's not the reason, because we all should exercise that right. But what would be some concerns? So we have a committee that we formed for that purpose, and the survey is going to help us understand where at some point in time we'll have a town meeting, and where would people feel more comfortable? Is it indoors? Is it outdoors? Is it, do you need PPE? Do you need face coverings? Would you be more comfortable with that, and gloves and hand sanitizer? So right now we're going through, we've had 2 meetings right now, and really right now we're looking at the election for June 25th. And our town clerk just got confirmation that that's, and she's on here, Diane. So you actually, if you want to talk, Diane, you can just unmute yourself, or we can unmute you if you want to add anything. But the town clerk just got the approval for the Buca School. So it looks like the election will be held at the Buca School, and we'll have safety protocols in place, and which may require folks to wait outside in a line, similar to when you go grocery shopping, and we're allow so many people in to vote at the same time, and we have protection. And Diane, I see unmuted herself. So Diane, you want to add to?
I love unmuting myself. So yes, we are having the election on Thursday, June 25th. We have permission to use the Bucher School. The Board of Selectmen do need to vote on that next time they meet, and we will spread that information to all town members. At the election itself, with the help of the Board of Health, we will be sure to have every safety protocol in place. We will have plenty of hand sanitizers. We will require masks, disposable pens, and plenty of spacing. So I think it should be as safe as can be. I will say that it's still even better if everyone voted by mail, which they can certainly do by getting an application from me, and I'm happy to mail the ballot to anybody.
Thank you.
Yeah. Thank you.
Thank you, Diane. All right, with about 7 minutes left, I'm going to go back through the panel and
Anthony, can I just address one further? My colleague Lynn Nardella had asked about precautions for playground equipment.
Oh,
and Lynn,
sure.
Unfortunately, that's a phase 2 thing. So we are still waiting to hear more guidance. I don't have any brilliant ideas, to be honest with you, about how we're going to clean and disinfect and protect sufficiently for playground equipment to be open. That is a later, remember we were looking at that graphic that Jackie pulled up of the phases. That is on there, and it's a later part of phase 2. So we're sort of in a wait and see what guidance will come from the state about how we can safely and successfully do that.
Thank you.
Oh, one other thing I'd like to say while I have the chance, since it's beautiful weather and we're opening up trails, I would be completely remiss as the town nurse if I didn't mention to people that tick-borne illness is a serious problem in Wenham, even now. And so as we're encouraging people to go out and use the trails, there's a lot of good common sense guidance about avoiding ticks on our website and on the mass.gov website and the CDC. Not that anybody wants to be wearing long pants, but you know, if you tuck your pants into your socks. But the most important thing is if you've been out on a trail, please do check your children, check yourself for ticks when you come home. If you can get the tick off sooner rather than later, that protects you from tick-borne illness. And we all want to get vitamin D activation, but with the days getting longer and the sun being hotter, do remember to use your sunscreen while you enjoy the open spaces on Memorial Day weekend.
Thank you, Mary Beth. Captain Gnapoli, for some final thoughts.
I just want to thank everybody again for all your support. The public's been great. I want to publicly thank the men and women of my police department as well, so they know, myself and the chief, how much we appreciate them hanging tough through all of this. And just a prayer out to all you, to your families, people you care about. Like we said in some of our meetings this week, there are some silver linings in it, and I'm sure it's been time for people to spend some extra time with the people that they care about and taking advantage of those opportunities, because the kids end up going in a million different directions when the world opens back up. So enjoy those little things. But thank you again to everybody.
Thank you, Captain. Dr. Ting, final thoughts?
As the chair of the Board of Health, I just want to thank everyone for joining us with the forum. I mean, for us, this has been great as a way to communicate in this difficult, unprecedented time. We will continue to work to keep the citizens of Wenham safe. If you have any questions and concerns, you can always get a hold of the Board of Health through the town hall, as well as I think it has Mary Beth's email. You can email her, not me. And you are all welcome to our Board of Health meetings as well. They're open to the public. We usually meet on a Wednesday morning around 8:30 by Zoom currently. So if you have any further concerns, that you can always join one of our Board of Health meetings. But again, thank you for everyone being so patient with all the sort of limitations that are being put upon you. But again, these are sort of what was needed to get us to where we are today. And hopefully things will slowly but surely improve and get back to normalcy, because I think we all want to get back to normalcy.
Thank you, Dr. Ting. And Chief Kavanaugh. You're muted.
You got me. Since it will be a beautiful weekend, try and stay safe and don't do anything risky, because we don't want to, police and fire don't want to respond. We want to stay safe too. And I just think the town has done such a great job, you know, risk control, wearing your mask, everything. It's just been it's been great talking with people in town. And it's, again, you are all safer at home.
Thank you, Chief. And Mary Beth, final thoughts? No? Mary Beth?
Well, I'm so glad to have another opportunity to talk to the residents of Wenham. I almost said residents of Wenham, and that would have been completely wrong. Oh, goodness. It's a pleasure to serve all of you in this capacity. It's a trying time for everyone. I think that the time at home fatigue is definitely setting in for many. There have been many difficult losses. I am grateful, as Captain DiNapoli said, for some silver linings, more dinners at home. Some nights that's great, some nights it's more of a challenge. But I just would encourage everybody to take as much good care of yourself as you possibly can, to be prepared as you go out and about, to have your face covering, to have your hand sanitizer, to have your sunscreen, your water, check your body for ticks, but try to be gentle with yourself and try to be gentle with those around you. Many people are feeling very afraid right now, and understandably so. Not everyone approaches this virus with the same level of risk. Some people are at increased risk and feel much more afraid. So we all just need to try to be neighborly and take good care of one another. And I look forward to times when we can meet in person rather than in Zoom. But I wish everyone a wonderful Memorial Day weekend. I hope you enjoy the prepared Memorial Day celebration that's on the website. And I wish you all very well. Please do reach out if there's any needs that you have that we can try to address.
Thank you, Mary Beth. You took my thunder. And yes, this weekend is Memorial Day. That's okay. And the town went through great efforts, and they have a pre-recorded for Monday at 9 o'clock. And if you drive by Town Hall starting Friday night after dusk, we're going to remember our fallen on Memorial Day by special lighting of our Town Hall in red, white, and blue. And thank all of those who have served and fought for our country. And thank you, everybody. Be safe, and we'll see you the next time.